Hello, this is Holly, and thank you for humoring me. Today, I'm going to be doing my makeup while I go over my latest Substack post, my sort of blog that I've been doing off and on, and will have a lot more time to keep up on now that I got laid off from my job, which is always fun. Um, Hooray and stage capitalism, right? Right before Thanksgiving and Christmas, they decided it was a really good idea to do that. So here I am. But again, thank you, and I am very happy to be able to go through this with you today. First thing I kind of wanted to caveat with in terms of what we're going to be talking about today is the concept of social determinants of health. That means different things to different people, and it is not as cut and dry as a lot of scholars and public health officials make it seem. So let me break it down a little bit. Social determinants of health are sort of several things. It is education, access, and quality. Um, Education funding comes from various sources, but the big three are federal, state, and local sources. Federal obviously comes from Congress. That's what a lot of the controversy lately in the Department of Education and the dismantling of that has been about. State, that's our state taxes and but then local is a real big one as well. Local funding, that's our local property taxes. So when you think about schools that are in regions with really, really low housing values, that's where we end up with schools that don't get as much funding as ones that are in regions with very high housing values. And so historical redlining, neighborhoods that just don't have a lot of new homes or homes that have been not well maintained over time for whatever reason. Places with, a lot of trailer parks or apartments instead of houses, nice houses that don't garner as much property tax, end up in a position where those schools have less funding. Okay. The next piece of social determinants of health is economic stability. So, simply put, a community is made up of individuals, right? And that community is only as stable as the individuals within it are. And so, if there is high unemployment, or if there are, a disproportionate of number of people living in a community that do not have high paying jobs. So communities of people living in low income housing are not obviously going to have high paying jobs. Otherwise, they wouldn't be living in low income housing. So these things, as I talk about them, you'll hear how they compound on each other and how they're interrelated. The next piece is social and community context. So as we're talking about community, we're also talking about community participation. So neighborhoods that don't feel safe don't tend to have a lot of community participation. You're not going to have, community events out in the street, barbecues, or, block parties to bring community members together when there's drive-bys. Like, that's just not a thing that's going to happen, right? And so that community participation, oftentimes, it is garnered from within. These events and things are planned either by neighbors. Oftentimes they used to be, at least, and that just doesn't happen quite as much anymore. So communities with things like HOAs plan community events. Low-income neighborhoods don't typically have HOAs, so they don't have that local, really micro-local leadership to create this feeling of community within the spaces where community members live. And so where that's lacking, community starts to sort of break down. Also, if people aren't living in a place for very long, so say they're renters and they typically move every year or every 2 years, then you're not building that community. You're not able to build that camaraderie with your neighbors because they're just not sticking around there very long. Communities where people own their homes, they live there for longer, right? And so they build that sense of community because they've been neighbors for a long time, and they know that those neighbors are going to stick around. That's happening less and less, especially now as people like me, millennials, don't have houses that we're buying. We're still renting, just because the housing market's so terrible everywhere. The next piece is community and built environment. That, again, is what we were talking about. How safe is that cul-de-sac that you want your children to be able to go out and play in? How safe is that park? How well maintained? Are they going to come across needles or something on the ground at the park? Or are they going to be able to go there and play safely? Do you need to go with them for them to play safely, or can they go on their own? A lot of us might remember being able to go and play on our own at the park, and that's just when we were little, and that's not something that happens very often anymore in a lot of communities. Now, there are some where you can, however, those tend to be more affluent communities. So again, this is all sort of coming together, right? And then the last piece, the piece that I find to be my area of expertise, my area where I believe there can be a lot of work done in a lot of various contexts when it comes to public health, is healthcare access and quality. So we're brought back to sort of the point of my article. Healthcare access and quality are integral to the individual's ability to thrive. If people are sick, they can't build community. They can't work, right? And so having a community grow and be productive is often directly linked to the health of that community. Now, if people are living in a place where there is not clean air or water, they're living right off of a highway or right next to some place like, say, in Colorado, Suncor, that is something where there is some government involvement that needs to be, instrumental in making sure people have a safe place to live. They're failing, obviously, in a lot of those spaces. But that's what keeps property values low too, right? So people already live in a space that is not healthy. They don't have access to businesses. They don't have access to healthcare. Their lived environment, the environment around them isn't healthy. There's not clean water in the streams because there's companies just pouring pollution into it. The air smells bad because there's pollution coming from oil refineries where children are trying to play. And then you expect housing values to go up and schools to get better funding and be able to grow, and then businesses to come into those communities and expand the access to resources that people living there might have. It's just not going to happen, right? So all of these things are connected very, very closely. Life expectancy in the United States continues to fall, and it's because we don't have all of these interconnecting pieces that make up this social determinant of health. We are becoming less and less healthy over time because all of these pieces have eroded. The United States falls behind the average life expectancy in the world. Average is 82.2 years old, and we're hovering around 77.5 years old. So that's a big difference. And those statistics, they take into account the COVID epidemic, right? But that was just a small piece. That declination for life expectancy was already there, and that gap was already there. This contradicts a lot of the policies that the MAHA movement is trying to put forward right now. They say that they're trying to find the root cause of disease while simultaneously dismantling all of the many things like Medicaid and community funding and grants and research into social determinants of health, and actually eliminating a lot of the quality reporting mechanisms for social determinants of health that hospitals and doctors' offices were reporting to try to get data. And so while they say they're trying to find the root cause of disease, they are actually stepping backwards because we've already found it. The root cause of disease is poverty, period, in this country. Social gaps, gaps in wealth, gaps in education, gaps in the ability to build wealth over time. If your grandparents couldn't own a home for reasons like racism, and the inability for people to get loans just simply because of the color of their skin, then how are you supposed to have any generational wealth to help you fund education and buy something of your own, right? Habits are built over time. If your parents have a college degree, you are much more likely to have a college degree yourself because those habits have been built over time, right? There's a neighborhood kid of ours that comes over sometimes for snacks. He tells us his parents work at Wendy's, and so he doesn't really have to do very well in school because that's what he's going to do. More power to you, right? Work wherever you'd like, do whatever you think is best for you, but those habits and those cycles build on each other. And when we're talking about, like, my article, feel free to go in and read it. That goes into all of these things a lot more clearly and sort of breaks it down. But honestly, if we don't have a really good grasp of what makes community, and then build on that with social determinants of health in mind to make sure that our children have a place to live that is not only clean but also safe, that is growing in wealth, so that their schools have funding to be able to offer them the same opportunities as every other neighborhood school in their area, then we're going to still continue to see regions and pockets and classes of people fall behind where others do not. We have to invest in everyone if we expect everyone to do well. And that's where collecting data on these social determinants of health and community wellness are really important. And that's something that, unfortunately, our federal government is stepping away from. So please read my article. It talks a little bit more about this, more in depth. And if you have any questions, feel free to reach out. I love to talk about this sort of stuff, and we will see you next time. I'm Holly, and thank you for humoring me.